Hello, and welcome to Let's Talk Transformation. So, here's a question to start with. What happens when the most technically brilliant person in the room decides that technical brilliance is not enough? My guest today is Dr. Larry Moss, a pediatric surgeon who spent 25 years at Stanford, Yale, and Nationwide Children's Hospital, literally holding children's lives in his hands. He ran the first medical center clinical trial in children's surgery published in the New England Journal of Medicine. And when he was at the top of his field, he made a decision that I think every leader listening will recognize as both brave and slightly terrifying. He stepped out of the operating room and into the boardroom, not because he couldn't operate anymore, but because he'd become convinced that the system itself was the patient. Larry, welcome to the show.
Thank you, Susie. Well said. The only thing I'll push back on is that technically brilliant comment. I think my wife might have something to say about that.
It's all about different perspectives. So, Larry, today, as president and CEO of Nemours Children's Health, you lead one of America's largest pediatric health systems, 2 freestanding children's hospitals, more than 70 care practices, nearly 2 million patient encounters a year. And you're using that platform to give visibility to something bigger, more systemic. The fact that children's health is not just about treating sick children, it's about the health of an entire country, its economy, and its future. So today's conversation will be about what it takes to move from an expert to an architect, from fixing to building, and from hierarchy to collective intelligence in a context where, let's be clear, the stakes couldn't be higher, could they? So, Larry, from the operating room to the boardroom, can we start there? What leadership assumptions did you have to unlearn when you moved from being a surgeon to also being a CEO?
So I would say that the core characteristics and personal traits and skills that I needed to be the best possible surgeon I could be, in many ways, are the opposite of the core characteristics and traits that one needs to be an effective CEO of a healthcare organization and ultimately an effective leader in transforming American healthcare.
Because in terms of, for me, surgery needs decisiveness, it needs individual mastery and control, whereas leadership of systems requires often the opposite. So how do you hold both at the same time, Larry?
Well, yes, as a surgeon, things are always time sensitive. It does require decisiveness. It does require a level of precision. And in surgical procedures, it's often better to make a pretty good decision promptly than a great decision over a long period of time. That really is the opposite of leading an organization where, unlike surgery, where you own all the decisions and you make largely all the decisions, I feel like my job as the leader of Nemours is to best leverage the collective intelligence to the higher of the entire organization and to have the patience and the fortitude to see that through so we can really make the best possible decisions.
And what leadership behaviors for you actually slow down transformation, Larry, even when intentions are good?
I'm a very impatient person. So if you ask me, did anything meet my expectations of pace? Pretty much everything I've ever done or encountered in my life, I would say it would, well, that took longer than I thought, and that took longer than it should have, and that moved slower than it. And so that's just kind of the way I'm wired. So I've over many years learned to just accept that about myself. The biggest change for me in leaving the operating room, and it would probably be worth going off on a little bit of a tangent about the why there,
Yes.
but the biggest change for me in leaving the operating room was going from a situation where I had a profound impact and made a profound difference for a very few people to trying to make a significant difference for a large number of people. And that requires a different mindset and a different skill set. And it's every day I'm still learning how different that is.
And it's essentially around, as you say, complexity and volume, because how do you have the same outcomes with such a complex system? And I think it comes to the whole idea of America's healthcare system and how it defines and incentivizes outcomes or volume. Can you say a little bit about that?
To get to that question, I'm going to tell you a little bit more of my personal history because I think that shines a brighter light on it and helps me explain it. So I spent my clinical life as a pediatric and neonatal surgeon. So I had the privilege of taking care of the most complex problems we see in healthcare. Kids
Mm,
with severe advanced congenital anomalies, babies born that needed operations in the first hours of life to save their lives, kids with advanced cancer. And all of that is the tiny slice of healthcare that America does incredibly well. Our healthcare system in this country is very, very good at taking care of highly complex, highly technical, demanding, and frankly, very expensive problems. And that was a privilege. And I'm grateful for the opportunity to be able to live in that part of the system and impact the lives of kids and families. However, I noticed very early in my career that for the other 99.9% in America, we don't just have a poor system, we arguably have the worst system of creating health in the entire developed world. And the facts would bear that out. If we look at the most important indicators like life expectancy, infant mortality, maternal mortality, we're not just near the bottom, we're at the bottom of OECD countries. And yet we spend more than double what most other countries spend. So
mm,
that frames the problem. And it was a problem I saw early in my career, but I was busy taking care of kids and doing
of
what I was
course.
doing. And it was kind of like a burr under your skin kind of thing
Mm.
where it bothers you a little bit, and then it bothers you a little bit more. And then I finally reached the point 7 or 8 years ago where personally I felt like I couldn't finish my career without trying to do something about that.
And what was that turning point, Larry? What made you have that moment of, I need to act, I need to do something?
It would make a better story if I can tell you some compelling anecdote where I went in the operating room and walked out a completely different person, but that's not the truth. It it
Mm,
it really I use that burr under your saddle analogy because it really was a growing, gnawing, gosh, this is,
mm.
every day I do A, but B is falling apart. I think it was more reaching the point where I developed the confidence that, gosh, Larry Moss, as an individual, actually could perhaps make an impact on something like that. And so I better try.
So how did that crystallize, therefore?
I made the decision that I wanted to have a broader impact on the healthcare system a few years before I actually made the change. And
Mm,
I was looking at ways I could do that. And the last thing I thought of as a vehicle for doing that would be CEO of a hospital or CEO of a healthcare system. Because I thought, well, if I
mm,
did that, I'd just be part of the problem. And I should be thinking about policy roles and think tanks. And then I came to appreciate that it's pretty hard to make a real difference from outside the system. You can only
yep.
make a difference from inside the system. And then this unique opportunity at Nemours really found me. I didn't find it.
Mm,
And I looked and I noticed a couple things. First of all, a big system in multiple states and multiple demographic. So the variety of places we operate are a microcosm of the country. So I thought,
mhm. Nice.
gosh, if
Yeah.
I can show that the Moors could do it, that demonstrates that the whole country could do it. And that's not an opportunity you get at just one hospital. So I thought that was cool. And then clearly, I wanted to be part of a system that only cared for children because children are not only, I always say, the most powerful lever to impact change, they're really the only lever. It's once health trajectories are set after childhood, we can make a massive effort and spend a lot of money trying to change those trajectories, and we change them a little bit.
Mm.
But in childhood, we change them a little bit and it has a massively positive outcome on the whole life of that individual and ultimately the whole life of society.
And like you say, sort of early childhood health is so important. And Nemours operates in a healthcare economy that is under enormous pressure, as we've already said. How do you sustain children's health initiatives when the financial initiatives of the system are sometimes pulling in the opposite direction, Larry? How do you manage that?
Despite
Mm.
the fact that our country spends $5.3 trillion on medical care, we
Mm,
largely do not fund children's medical care, even at the level where we fund adult care in this country. So that's a little bit off on a tangent, other than to make the point that over half of kids in this country get their healthcare coverage through the Medicaid program. And the Medicaid program in most of the 50 states doesn't even cover costs. So, as a children's hospital CEO, your job really is a cost shifter, and you've got to use other sources of revenue and other sources of support to make the whole thing work.
Mm,
That's
mm,
just to run the hospital and provide the care to the patients. And that's something I had to learn how to do and learn how to do really well, because we got to run our system in a viable, financially sustainable way, provide the highest quality of care to that 1% of the 1% who need our
mm.
tertiary quaternary services, to earn the right to do all those other things, which I call creating health in the other 99%.
Yeah, I like that. Creating health in the other 99%. And to come back to the idea of creating together, what role does cross-sector collaboration play in the way you can impact healthcare for children?
So let's talk about, Susie, what health really is, because the
Mm,
answer to that question is embedded in that fact. Largely in the United States, we equate health with medical care, when in reality, nothing could be further from the truth. There's a wealth of data that support the concept that health is about 15% due to medical care.
mm,
85% is due to education, food security, safe housing, freedom from violence, and a host of other factors where kids learn, live, play, and grow up.
mm.
And so if we want to create health, we got to realize that a significant part, in fact, the vast majority of our attention is going to be on things other than medical care.
Mm.
But let me pause there and say that doesn't mean the Moores and me as a healthcare CEO doesn't care about the delivery of
Of
the
course.
absolute best medical care, because it's the whole package. So
Of-
those other things I mentioned are an and, not
Mm,
an or.
mm.
And what I like to say is that Nemours, we don't do less medical care, we do more health.
Yes.
So
Yes.
that's getting around to your question, which is about partnership and collaboration. We, our health system, are experts in the delivery of high-end medical care. We always need to excel at that at the highest level.
Of course.
We're not experts in housing, food security, education, all of those other things. We believe that we can be the quarterback that brings all those things together into a team that can really create health. But we need all the other players on that team, and we
Mm.
won't have them without close collaboration and without trust.
And how do you practically design for that collective intelligence, Larry, in that ecosystem, an ecosystem that's as complex as Nemours? Because you're right, it's a whole kaleidoscope of different pieces, and you don't control all of them. And of course, you don't have expertise in all of them.
Well, I'll give you a couple of examples. In our Delaware Valley operations, we have 18 school-based health centers where
Oh, okay.
we deliver medical care literally in the schools, a place that families trust.
Hmm.
Families that don't trust the healthcare system, they trust their local school, and they trust the principal, and they trust their teacher. So that's a vehicle into those family
Mm,
lives. A way to provide some basic care without taking the kid out of school, the mom or the dad out of work, and disrupting the family. So that's one anecdotal example. A larger example is Nemours has committed to a kindergarten readiness initiative
mm,
where we are demonstrating in two very different zip codes that a health system can elevate kindergarten readiness, not just in our patients in those zip codes, but at the population level in every child in those zip codes. So
mm,
why does that matter? Being kindergarten ready highly statistically correlates with being able to read at grade level in third grade. If you can read at grade level in third grade, you're going to graduate from high school. If you
yeah.
can't, you very likely won't. If
Mm,
you graduate from high school in this country, your life expectancy is 12 and a half years longer than somebody who doesn't. Your incidence of cancer is 50% lower than somebody who doesn't.
mm,
Your incidence of heart disease later in life is 30% lower than somebody who doesn't. So massive impact on life trajectory. And you could make an argument in years of life saved and years of life contributed, doing kindergarten readiness successfully in two zip codes probably contributes more overall to society than all the medical care will deliver in the next 5 years.
Well, yeah. So the difference in systemic impact is huge. And how do you distinguish, therefore, Larry, sort of a fixable technical problem from a true adaptive challenge in healthcare? And why does that distinction matter so much for the leaders?
So when you use the word technical, I think that what that implies to a lot of people is complicated. And one of the biggest barriers to advancing American healthcare is we've convinced ourselves it's too complicated to fix. Oh, it's too big, it's too cumbersome. There's all these different levers of commercial insurance and Medicare and Medicaid, and we'll never figure this out because it's so complicated. And I have the opposite view. I actually think it's really simple. And it's really simple if we go to incentives. So I think what you're asking is how do you address problems that seem complicated or untenable in systems that seem complicated and untenable? And my approach is to go to the incentives. And people follow incentives the way water follows gravity. You set up the incentives the right way, and the things you want to have happen, happen. Now, today, of that $5.3 trillion we spend on healthcare, almost every penny is incentivized to result in the opposite of health. So we don't pay for health in this country. If suddenly we prevented all these diseases and chronic disease was cut in half, our medical industrial complex would collapse and go bankrupt. Right now, we don't pay for healthier people. We don't pay for a healthier society. We pay for two things: volume of medical care delivered and complexity of medical care delivered. The more medical care we deliver, the more the companies that make up the US health system get paid. And the more complex that care is, the bigger multiplier there is on how much we get paid. So we are getting in the United States exactly what we are paying for. We are getting more MRIs, more cardiac surgical procedures, more CT scans. Our per capita rate for all those things are way above our peer countries, even though we have the same burden of disease. Why? Why do we do these things so much more? There's a financial incentive to do them. I'm not suggesting healthcare providers get out of bed thinking, well, how can I do unnecessary things to make more money? But at the system level, that's what we see. Because we don't understand what health is. And that was point number one we talked about is health isn't really medical care, it's other stuff. Point number two is pay for health. Start incentivizing health and we'll start getting health.
What's your vision for how that can be done? I mean, Nemours is a great example of how holistically you can finance health and not just medical care.
So conceptually, and there's different vehicles that you could do this in different markets. So I don't want to say there's a one size fits all answer, but conceptually, we need to leave a pay for volume, pay for complexity model and go to what I call a pay for health model. And we need to set up the economic incentives. So me as a health system CEO that's running children's hospitals in multiple locations, we should set up the system so we, Nemours, and every other system benefits financially from keeping kids healthy. So when parents bring their kids in, our financial incentives align with what we want our incentives to be, which is keeping that kid out of the hospital as much as possible and in as healthy a place as possible. We don't do that today. An anecdotal example of where Nemours is doing that in one of our markets is we've constructed in partnership with the state of Delaware, and I do mean partnership, the nation's first pediatric global budget model, where we're on a trajectory with the state where instead of doing what we usually do around Medicaid funding, which is the health system sits on one side of the table and says, pay me more. And the state sits on the other side of the table and says, we're going to pay you less, and you haggle it out and find some number. The way this is designed, we in the state of Delaware are sitting on the same side of the table saying, let's agree on what healthy looks like. Let's figure out how many dollars that needs on an annual basis. Let's put those dollars in a pot Nemours, you go spend those dollars anywhere you think you'll create health. And if you create enough health that you spend less on medical care, keep the difference. And if you don't,
Right.
and you spend more on medical care, then you eat the difference and figure out a way to pay for it. That is truly aligning financial incentives with health.
Totally.
And we're just getting started with this model, but I'm thrilled that instead of working at cross purposes with the
Yep.
people who are trying to keep healthy, we're now on the same side of the table with them.
Which is brilliant. And you're already stepping into that model. What are you seeing as the adoption challenges, but also opportunities there?
I appreciate you saying that it's brilliant, Susie, but I'm going to say it's not brilliant. It's freaking obvious. It's what
Yes.
we should all be doing
Mm,
if we could just get out of our own way and think about, well, we're spending a lot of money on something. What are we trying to buy? We're trying
mm,
to buy health. So why are we putting all that money towards the opposite of health? Let's just put it towards health. So what keeps us from doing that, in my opinion, isn't because it's complicated. It's because we just can't summon the will and the courage to do what is so obviously the right thing to do.
And it's so far from what they do today. It's so far from the definition of health. And it's so far from what the system incentivizes, to come back to one of your first points. So, how do you see that playing out? How can we leverage that system? You're right, Larry. It's obvious to you, and it is obvious when we think about it rationally. But of course, the way we've always done things is not like
Yeah.
that. How do you think people can leverage that? And how can you leverage that through leadership?
I can't answer your question for other people, so I'll answer it for myself, and I'll tell you
Okay.
how I approach that. It is not to go get elected to Congress and introduce some new policies or try to get appointed to work at Health and Human Services and see if we can make changes.
Yeah.
In my mind, that's not how I think I could get things done. So my approach is I have the privilege, and it is a privilege, to have a key leadership role in a health system that involves taking care of kids in the whole spectrum of demographics and societal situations where kids find themselves in this country. So I'm going to use that platform to show all my peers and everybody else out there what's possible. So that's a really important distinction. I'm not telling people and other systems what they should do,
No.
because I don't walk in their shoes and I don't know their constraints, and I'm not going to presume to put myself in a position where I'm telling other people what to do. But I am eager to put myself in a position where I can show people what can be done. And implicit in that is a challenge. Maybe you could think about whether you could do that in your world, because it's working really well in this world. And we think this world's a pretty good microcosm of our whole country.
And leading by example, and in your ecosystem model, you're of course empowering autonomy from a leadership perspective. But in healthcare, where the margin for error is often life or death, how do you let go of control without losing standards, Larry? How do you manage this more decentralized decision making?
So probably fair to say that decision making is somewhat more decentralized. We could debate that, but I can go there. I think what isn't decentralized, though, is the values and the basic principles. The basic principles of understand what health is, pay for health, start with children. We haven't got to the start with children part, but we'll get to that in a minute. With those three principles as guideposts, we're not decentralizing off of that. We're all unifying, saying those are right and those are what we're going to do. And we might get there in different ways, but let's stay unified on what the destination is and where we're trying to get.
So the collective vision is still there.
And that's the first, when I started in this role at Nemours, it was a very different system with pointing to some different operating models and different ways of doing a lot of things. And my first job in my mind was to convince everybody, here's a destination we can all want to go. Before we talk about, well, let's start changing our operating model to get there. We started with the why. And I'd say that was a several year process, getting us all unified around the why. And then we could go to work with the what and the how.
Yeah, and it's important, isn't it? Because the why as you said, is what keeps you together when things get either dispersed or stressed or pressured. So, but what have you learned from that about resilience at a systems level, Larry? Not just personal grit and personal resilience. Could you share an example with us of what you've learned about system level resilience?
Yeah, really good question. Systems are inherently resilient and much more resilient than people.
Mm,
But systems are resilient and tend to be able to continue to operate as they've been operating, whether it's good or it's bad. I
mm,
mean, a fundamental core reason why transforming or reforming healthcare in the United States to something that serves us better as a society, part of the core reason that is so darn hard is because the systems are so resilient. They're
hmm
so resistant to operating in any way differently than they've been operating. So when you get things right, in my view, resilience is your friend. When you got things wrong, it's your enemy that you're trying to break down.
mm. So I'm hearing what you're saying is you're using resilience as infrastructure, positive infrastructure,
Yeah.
and not necessarily going against the system. If I look forward, what capabilities do you think future pediatric health systems need to build now to survive the next 5, 10 years?
I'll answer this really simply. I think it's one core mindset shift,
Mm,
which to me feels very comfortable. I'd say to others in the industry feels highly radical,
mm,
is that I believe as children's hospitals in this country, we should change from believing our job is to take care of sick kids who show up at our doors who need our help, to change that fundamental viewpoint to our job is to be the stewards of child health in the areas in which we operate. And that's a radically different view to say that my job as a health system CEO isn't just to run a really good hospital and take really good care of kids. It includes that.
of course.
And I believe my job is to be accountable for the health of every child who grows up in a zip code that I'm responsible for, whether or not there are patients and whether or not they ever need any complex procedures in our operating rooms or in
Mm,
our emergency departments. That's a mind shift. And that I believe is specific to children's healthcare. I'm not suggesting my adult colleagues should have the same viewpoint, but childhood is unique. It is the place where a tiny investment in health can make a massive impact. And if we haven't created health once people have become adults, we can only make little changes and little improvements. But the kind of big, massive changes that we want to make as a society, they have to start in childhood.
yeah, absolutely. Because I was going to ask you, what can leaders everywhere, not just in healthcare, learn from pediatric healthcare? Would your answer be the same in terms of the mindset shift?
Well, the way I take this out of healthcare and apply it to other industries is be highly cognizant of where the leverage point is.
Mm,
I think all systems, whether we're talking about US healthcare or any system, has leverage points and where a little bit of effort makes a big impact.
mm,
In human health, it's childhood overall for sure. It's the real tip of the spear of leverage is birth to age 5. And
okay.
think trajectories we set and things we do that can make a massive difference. And I can give you example after example where
Mm,
seemingly tiny, trivial things done in that age group have an impact when people are 50, 60, 70, 80 years old that is so big you can hardly even measure it.
so the time is now, and being cognizant of that
Yeah.
is really important. Larry, time is running, but given your eclectic career to date, I have to ask you, what is the most transformative thing you have ever done, either as a leader, a surgeon, or a human being?
I'll give you two perspectives in transformative. Earlier in my career, I had the privilege of separating conjoined twins and
Oh,
being able
wow.
to pull that team together and radically change these two little girls' lives and get such a successful outcome, you could say, what a great transformative thing to do. On the completely other end of the spectrum, being able to play any meaningful role in profoundly changing healthcare in the United States. Not that I think I'd do that by myself or anybody does it by herself,
No.
but even to be able to contribute to something that important is just as profound to me. And neither is bigger and neither is better. When people say, oh, you left the operating room so you could have more impact, I just say, stop. That's not what I'm saying at all. I left the operating room so I could have a different kind of impact that was more meaningful to me in terms of what I wanted to do at that time. But they're both important. Profoundly changing a child's life, one child at a time. What could be
Huge.
more important than that? Changing a whole system that's going to impact tens of millions of people. What could be more important than that? It's not either or, it's and.
Of course. And it's always something that's more holistic and bigger than you in either case.
That's what, in my view, human experience and rewards and human happiness is all about, is to be able to be an agent of making something or somebody better.
Totally, totally. Yeah. And I love the idea of being in radical service of humanity, but other teams, other organizations, other communities, other human beings. Larry, if you could give one last piece of advice or a call to action to the senior leaders listening right now, whatever sector they work in, what would it be?
Don't be afraid. Like I referenced earlier, it isn't complexity or technical challenge or some mysterious forces that are keeping us from fixing American healthcare and doing it right. It's fear. It's fear of getting out of bed and doing things differently and getting all the complexity out of the way and just doing what is obvious.
So just stepping over yourself. I know it sounds simple and it's not as simple as that, but thank you very much, Larry.
Not simple, but possible.
Yes. Yeah, I agree. I'm going to leave our listeners with that. Thank you so much for coming and sharing your insights, your career, your thoughts.
It was a privilege to talk to you. Thank you for the invitation.
It's been super. I've learned loads. Thank you so much. You can find out more about Dr. Moss and his work at his LinkedIn page and also at nemours.org, nemours.org. But what stays with me is that the skills required to heal an individual are distinct from those required to heal a system, yet both require a commitment to service and to the collective, to a quest that's bigger than us. So by focusing on children, aligning financial incentives, and leveraging the collective intelligence of an organization, he has provided a roadmap for anyone looking to make systemic impact. And I think most of us are. Transformation is never easy, and it's rarely happening at the speed we desire. So the most important takeaway for me is this shift. It's that challenges are not insurmountable, and that there are always ways of impacting the system positively, however small we feel and however big the system feels. Start small and build from there. We hope you enjoyed this episode, and you can also find my link in the show notes if you're looking to understand how this could work for your team or for your organization. And until then, keep focusing, keep aligning on your vision, and keep leveraging the collective intelligence of your system, whatever that may be.